Hello, everyone. My name is Dr. Jacobs. I'm a doctor of physical therapy, and I'm the inventor of advanced soft tissue release ASTR specialty. I'm also a cancer survivor, and I used to suffer from chronic migraines, headaches, pain, and fatigue before I invented ASTR specialty. Right, Christian, tell me what's going on with your elbow. What happened?
Um, Baseball, I guess I've been pitching a lot.
Okay.
My arm just started hurting.
Mm-hmm. So, how much pain do you feel there from 0 to 10? 10 is emergency room, 0 is nothing.
6.
6. And is that like a considered constant pain or just comes and goes?
Like constant.
Constant pain. Where do you feel it?
I don't know for here.
Right here. How long has it been going on?
Like 1 to 2 years.
1 to 2 years. And at worst, how much pain do you feel like when it's get bad?
Like 8.
8 and in the same spot.
Yeah.
What make it worse? What make it really painful?
But I throw a lot. Like a lot.
When you throw a lot? Okay. So we're gonna do a few range of motion and see if that's aggravated. But before that, did you have any treatment for your elbow?
No.
No? Okay. So let's extend your elbow and tell me how much pain with that.
Like 5.
5, and you feel it right here?
Yeah.
Okay. What about
Like 6.
6 in here?
Yeah.
What about turning in?
5.
Okay.
Like, yeah, like 5 still.
So the worst range of motion is like doing this?
Yeah.
Okay. And you feel it right in there. Make sure what I'm doing is not painful. Okay, so we'll have you turn toward me. Okay, relax, relax, relax. Relax. I'm not gonna give you injection. Not now. Is it painful here?
No.
In here?
I feel like tingly. in my fingers.
How often do you get the tingling pain?
That does happen too when I pitch. Like sometimes.
Which fingers?
Like these two.
These two?
Yeah.
Okay. Is it tingling or it's okay?
No, it's good.
Mm-hmm. Let's roll this up a little bit more. How's that? Is that painful or it's okay?
No, it's good.
So most of your pain just localized here, and sometimes it's just radiated to numbness in there. Yeah. Mm-hmm. You feel this knot here?
Yeah.
Remember the scar tissue we were talking about?
Mm-hmm.
So our body has to go through 3 stages in order to heal. First stage is inflammation. Second stage is the proliferation. Third stage is the maturation. So the second stage, that's when the body starts to build the scar tissue.
Okay.
And here you can feel the knot. Scar tissue, it's like you feel a knot in the muscle.
Oh, you could feel it?
And you can see my hand is just rolling over it. And I have a tools that I will show it to you. You're gonna feel it with the tool.
So he has a knot there?
Yes, you feel that knot here?
Yeah.
You feel that bump here? Okay. That's a scar tissue. Mm-hmm. Is it too much or it's okay?
No, it's good.
Yeah, so our muscle should act like a rubber band. When you contract and relax, it does this.
Mm-hmm.
When you have a scar tissue, it's like you have a knot in the rubber band. So when the muscle contract, it does not stretch much. Instead of stretching like this, just
Oh.
stop. And it's very typical for golfer elbow that you have a scar tissue in the biceps area, in here.
Mm-hmm.
That because the biceps are attached here to here, and when it's you have a knot, the lens shrink
Mm-hmm.
because you don't have room to stretch it.
Mm-hmm.
So especially when he does extreme range of motion and twisting, you try to stretch the rubber band that's has a knot that prevent the stretching.
So is that caused because he doesn't stress before he does exercise?
Stretches is not effective.
Oh, it's not the stress.
It's not stretches based on the studies not really provide anything. You know, not even decrease the risk of injury. There is better way of decreasing risk of injury. This happen either from overtraining or not warming up enough if you have it like with a sports injury. So I'm gonna go over the proper way of warming up, and we wanna make sure he does not overtrain.
Right.
Because if you work like practice every day without break or something like that, you're just overtraining or you know. So I'm gonna give him some tips on how to avoid this in the future.
Okay.
And there's a couple of things we can do to actually decrease the inflammation from the training. Even if he need to train the next day, there's a couple of tricks he can do to, so his body will not, have a lot of issue with his
In the future.
Mm-hmm. How does that feel? What I'm doing?
It's good.
Is that too much?
No.
Make sure you say something. Is that painful? It's okay.
No, it's good.
Mm-hmm. And there's a big knot here. You feel this one?
Yeah.
Mm-hmm. So he has several knots all over scar tissue. It's very typical with
What's typical?
throwing, Is that too much?
Does it feel better?
Yeah, we'll work on, I just need to, I will show you now the scar tissue actually. So where he has the scar tissue, you will see more redness, and we're gonna feel the grinding of the scar tissue. Do you wanna feel it?
Oh yeah.
Yeah, so let's come and hold here. You feel that? Grinding?
Oh wow.
That's the
It
scar
is good.
tissue. Feel this area, how nice and smooth,
Oh yeah. You can tell the difference.
and here. You
Oh,
feel
yeah.
the grinding, that's the scar tissue.
It's like going
not-
on.
Yeah, so it's like
Down.
like the tool is going over a
Or-
rock. You
Oh,
know, so
Oh, it's
you
bad.
can feel it, and you feel this one.
Yeah.
You feel that, all that scar tissue, and you will see in the skin where he has a scar tissue. It's there's redness compared to the area that there is no scar tissue.
You can feel the bumps.
Yep, that's a scar tissue. Yeah. So that's very typical with golfer elbow or tennis elbow. And you can see it's right in here too. You see all of that? And he has, make sure what I'm doing is not painful, okay? Okay, I'm gonna go to that side. Too much, too much. Is that too much? Can you feel it?
Yeah.
Is that painful or something?
That's good.
You feel all that scar tissue, yeah, all this part. Yeah, that should not be there. So that pulling on his elbow, and sometimes that cause inflammation. So today we'll know like if he purely stuck in the proliferation stage, or he's going back and forth between proliferation and inflammation, based on his response to the treatment.
So it's really inflamed.
Well, we'll know.
Oh, okay.
I don't know yet, actually. Well, I can tell, like, I have an infrared camera to see how much inflammation, if he has inflammation, and where he has
So right now
inflammation.
work on the muscle.
Right now, I'm working on the proliferation stage to see, because he said he had a constant pain, so we'll see how he's doing with that. And you can see here, look, the area that is red, look. All of this, and here you see like patches of red here.
Yes.
That's and so the other area there's no scar tissue. Here it's look okay, but he start to have more redness in here.
So where it's red, that's where all the
Scar tissue, all those bumps, and you felt bumps in those areas. Yeah, I felt it too.
That's a lot.
So that's where he has a scar tissue. All of that. So the blood start to rush there. That redness should disappear 10-15 minutes. Okay. So let's do the movement now. And tell me, do you have constant pain or the pain is gone now?
3.
Okay, so 1 down to 3. Okay, let's do the twisting.
It's good.
You see, that was 6. This one was 6. Okay, let's drink some
You don't
water.
feel it?
And we'll try it again.
Good.
Yeah. Do you drink water in general? Not much?
Not much.
Let's drink a little bit more. Let's drink a little bit more water because we need to flush out the scar tissue release and the toxic. Otherwise, you might feel soreness from the scar tissue. So that's, yeah, that's good. Okay, let's move it again and tell me how that feels. Still feel it or it's gone?
Oh, it's gone.
Okay, let's move it around again. And let me know, do you feel any pain or it's gone?
No, I don't feel nothing.
Okay, alright, so you can turn around and tell me what you think about the treatment.
It was good.
You
Now
feel,
I don't feel no pain.
you don't feel pain? That's good, awesome. Thank you so much. Thank you.
Wow.
Feel free to subscribe to my channel to get helpful tips on how to relieve pain. And if you are a healthcare provider and interested to be ASTR certified, you can follow the link below. You will get information on how to register for ASTR online class. There's over 40 studies that support ASTR treatment model, and also there's over 400 studies that utilize by ASTR treatment. And feel free to check over 220 videos that most of them actually real treatment videos. We'll see you soon.